Hi everyone, welcome to our Monday night's live session, and today's topic is COVID-19 and patients with autoimmune or inflammatory diseases. And I have with me Professor Dr. Sargunan Sockalingam. Just give me a moment, let me try and add him in. One moment. So we'll be talking about anything to do with SLE. Hang on just 1 second. It's always that. Let me see. It's been almost a week I've been doing this live, and there's always glitches in the beginning. But as we wait for Professor Guna to join us, we'll be talking about anything and everything related to rheumatology. And excellent, he's just joined us. Prof, I've sent you an invite. Maybe you can accept the invite. Are you able to do that? Are you able to join us on the... I sent you the invite on the platform. Are you able to join us? I can see your messages, but I tried sending you the invite. I'm not sure whether this works on both. Hang on, I've sent you a message as well as the invite. It says here you've been invited. Would you like to join from your phone? Would that be easier for you? Okay, I'll hang on. So while we wait for Prof to join us, maybe I'll just introduce him a little bit. He's currently the head of Department of Rheumatology at a local university hospital. And he is also a member of the Asia Pacific Lupus Collaboration. And I've known Prof since my early days as a doctor, many, many years ago. Not so many, almost 20 years back. And he's an excellent person, as well as a very knowledgeable person when it comes to rheumatology diseases. Okay, got it.
Hi.
Hi, Prof.
Yep, go on. You were saying fantastic stuff about me. Keep going.
Yeah, I was just introducing everybody to how fantastic Prof has been. But an absolutely wonderful person at heart. And thank you so much for joining us today to clarify, because I've had so many of my followers messaging me and asking me about arthritis, SLE, lupus, and immunomodulating medications. And also I thought, who would be the best person but a rheumatologist himself to answer these questions and clarify their doubts. So without further ado, I mean, I've introduced you, but would you like to tell us a little bit about yourself?
Hello, everyone. Yadav, RakheeYadav, that's how I remember you. I know Dan is still in social preventive medicine, yes?
No, he's retired, officially retired just before the pandemic started. So, but he's still actively working with conferences and all that. Yeah.
Great. Yeah, so, well, I remember you as a medical student, and now you're a hotshot pediatrician, mother of four kids, yes?
Yeah, 4. Yes,
wow,
4 kids,
yeah. I know Sharon Paul as well, and yeah, great to see all of you have done very well. Very proud of you. It's one of the best things to do is, to see your students do very well and keep it up. Yeah, yes. And yeah, so I'm Sargunan. I work in University of Malaya Medical Center and I'm a rheumatologist, and yep, that's my specialty, autoimmune disorders. And I do have a post of professor, only because I'm old. And yeah, once you cross 50, you have to be professor. Yeah.
But you don't look that old. So must have found the
Thank
magic
you.
mountain of you.
Keep going. Yeah, you're doing great. Keep going. It's working. Yeah, yeah. It's like
So this is not a paid sponsored program, just in case anybody is wondering.
you should have a Twitch account. Do you know Twitch?
Yeah. Oh no, I
Yeah.
don't know what a Twitch is.
Check out your girls may know what Twitch is. So yeah. So
Oh
it's
God, I'll go and check
it's
it out soon.
yeah, it's a very new platform where people actually like yourself are live, but it's more of
Okay.
a real time continuous thing. Like you can have a Twitch account where people see you working and you
Oh.
talk to them. It's really like out there, real life experience, and people get to see. It's like a reality TV. Only thing it's absolutely real. It's amazing. Check it out. Yeah.
Wow. Okay, wonderful. I'll go and check it out after this. So without further ado, maybe I'll get into some of the questions that I've been thrown across in the past couple of weeks. What is the current recommendation for patients with autoimmune or inflammatory diseases with regards to the COVID-19 vaccination?
Yeah, because of the increased risk of COVID-19 in these patients, understandably, because as you've rightly mentioned, they are on immune modifying drugs. And there is this perception that they are immune suppressed, which is not exactly correct in that sense of the word. We don't say that they are immunosuppressed, as in a condition called, you might be familiar in primary A gamma globulinemia. That's really immunosuppressed. There's no immune system at all.
Yes.
Our patients have an immune system. In fact, it's overriding. It's overactive, and that's why they're sick. And what happens is we give drugs that tone it down, perhaps to what we think is normal or somewhat sub-minimal. It doesn't work for us to completely immunosuppress them. Of course, in patients with lupus nephritis, when we give them drugs like cyclophosphamide, yes, now they become completely immunosuppressed, and we have to give them drugs like Bactrim to prevent them from getting fungal infections of the lung and so on, right? Yeah. So, but the story is correct. Your point is right in that people with basically autoimmune disorders have a higher chance of getting, higher risk of getting the more serious forms of COVID. So we understand that. So when they do hopefully they don't, but if COVID-19 affects them, because of the number of drugs that they're on, they have probably higher than percentage normal population, so-called normal population, higher percentage of them do get more severe forms of COVID-19. Therefore, they must be vaccinated to prevent them from getting COVID-19 if that is possible. Vaccination, or if you can't prevent them, if they do get COVID-19 post-vaccination, in that they get severe forms.
Sorry. Hang on. There was a connection issue. Sorry.
Hi. The line is not so good. You missed me at some
Can
point.
you hear me?
Yeah,
Sorry,
I
can you?
can.
Okay, all right. So we basically, just to reiterate what you said, patients who have autoimmune diseases or have any sort of inflammatory diseases, they are high-risk patients and should definitely get the vaccine. It's just that when and how. Most severe, high risk in getting more severe COVID. So they should definitely get the vaccination, right? So your line is a little bit
That's right. Is it my side or your side? Yeah, it happens.
On my side, it looks on your side, but then do you see me circling? Hang on.
Okay, we'll wait.
Is it better?
We'll wait.
Is that better? Sorry, I'm so sorry, guys. Okay, is that better?
Change location.
Change location. All right, cool. No problem.
That might work, yeah.
Not so
okay.
great.
How are we now? We're okay?
We're okay. I think we're okay. A little bit blurry, but yeah, okay, then much better. Yeah, so just to reiterate, patients who have autoimmune and inflammatory diseases are high risk. of getting severe COVID and should definitely get the vaccine. So what about patients on rheumatoid arthritis and on medication? Or maybe not even on medication, patients with rheumatoid arthritis. What about them? Should they get the COVID vaccine as well, the COVID-19 vaccine?
Yeah, you've answered that. Yeah, they have to get the COVID-19 vaccine for the very same reasons. There are a few reasons for this. One is they are already at higher risk of developing severe forms of COVID with or without treatment. And on treatment, quite a number of the drugs does to some extent suppress the immune system. Plus, they already have a risk of developing interstitial lung disease. So if COVID-19, they are unfortunate enough to get COVID-19 and an already compromised lung. So that's not really good. So they must be vaccinated. Yeah.
Excellent. Okay. And is there a preference to what sort of vaccine they should get? Like everybody, we only have 3 choices in the country at the moment: the Pfizer, the AstraZeneca, and the Sinovac. So is there a preference to which vaccine they should get?
The good news is no, there isn't any choice. However, let's put it to you, the safest vaccine for any patient with a rheumatological disorder and who's on treatment is going to be the killed vaccine. The inactivated vaccine. So Sinovac is the inactivated vaccine, right? Yeah, so that would be the safest. But with the new technology coming in, like with the mRNA vaccines, we know that they are pretty safe as well. It's the people who are being injected an attenuated form of the live virus is what we're about. But I think the line is bad again. Are we okay? Can you hear me?
Yeah, we're okay. You were just saying something about live attenuated vaccine.
Yeah, they are the ones we are a little bit careful, but we do know that whatever live attenuated or modified virus, so we know that one of the vaccines, the modified chimpanzee adenovirus. So there was a little bit of concern, but so far from the data we have, it's not bad. We think we are giving the vaccine to people from who have this disorders. So we are giving the, if you permit me to say, AstraZeneca vaccine to them. So it's okay. But Rakhee, you're absolutely right about one condition where patients with immune thrombocytopenia, patients with antiphospholipid syndrome, those patients who have a tendency to develop low platelet counts and who have history of disease which is linked to thrombosis, whether arterial or venous. So we avoid giving the current AstraZeneca vaccine for them. We actually choose for them to get the Sinovac or the Comirnaty Pfizer vaccine. Yeah.
I see. And we have just a question down here. Hi, Prof. Which group of patients should we get rheumatologist review first prior to vaccinating?
Right. Generally, a review, the question is what we mean by a review. So most patients are pretty stable and we tell them, look, go ahead and get vaccinated. We can even do it by phone. How have you been? How are you feeling? What are the doses of your medications? When we have that data, then we can just even remotely say, go ahead and get your vaccine, because the priority is the vaccine. But I might end up giving a lecture if you will permit me right now. Yeah.
Go ahead.
Yeah. So the question arises with as you mentioned earlier, those who are not on treatment, right? So those who are not on treatment, yeah, go ahead and get the vaccine. That's absolutely fine. But it's like we have like patients on methotrexate for rheumatoid arthritis. So we tell them that you omit or you skip your methotrexate dose, the one that you're going to take the week after the vaccination. You get me? So if the vaccine is on Friday, and if they take their methotrexate on Monday, they tell you the following Monday, drop the methotrexate. The Monday after that, you can go ahead and start again. That's fine, right?
I see.
So you got that? Yeah. So that's something that we hope that maybe you can tell patients that in case they don't have the luxury of being able to meet their rheumatologist or being in contact, we are telling everyone to drop their methotrexate dose, one dose the week after their vaccination.
the vaccination. Okay,
Yes.
and I think what we mean by review is actually the pre-vaccine, the PVA, the pre-vaccine assessment
Correct.
form.
That's right.
So there
Yeah.
are some patients who require that if they're getting vaccinated in the mega vaccination centers, as compared to some patients who are getting vaccinated in a hospital-based environment. So I think maybe that's what they meant. So I think if you're unsure, it's best to just get a PVA from the rheumatologist just to
Correct.
be
Yeah.
on the safe.
Yeah, that's
Because
what
if you
I'm
go to
doing
a
nowadays.
vaccination
Yeah.
center,
Yeah.
if you go to a vaccination center, you might not get the same expertise like a rheumatologist like yourself to decide whether you should get the vaccine. So it's always best to get your rheumatologist to give you the PVA before you go to a vaccination center. It's different, of course, if you're getting vaccinated in the hospital where you're being followed up. So in your case, if you're a patient in UH, you will get your vaccine in UH, then I think shouldn't be a problem because you've already decided the date for that. Am I right?
Correct. Absolutely. Yeah. So, yeah, you're right in that. You see, Rakhee, the PVA is mainly to allay the fears of the people at the vaccination centers. Like the moment they hear, oh, you're on this drug, they get very worried. You're on hydroxychloroquine. Oh my God. Oh, are you sure? Please go get your doctor. Yeah. So they get real worried. We tell them, no, it's absolutely fine. But there is another problem in that people on drugs like Celsat, mycophenolate, people with drugs on on biologics, so I think not much confidence, and understandable that people at the vaccination centers would say, you know what, we'd be more comfortable if somebody signed it, and that's what we do. We just say, hey, like, no problem, come sign, go, off you go and get your vaccine.
Absolutely. So just to put a side note that at some of the mega vaccination centers, they vaccinate up to 10,000 people a day. So imagine that doctor signing like 500 consent forms, you know, so you can't expect the doctor to go through the medical history. So they expect you to do that with your doctor and come with an assessment form. So at least you've clarified all the bases before you even go to the vaccination center. So thank you so much for the clarification. So now, can I ask you, can a patient develop a flare post-vaccination? You know, like if they have SLE, will they develop a flare? If they have lupus, any other form of lupus, can they develop a flare post-vaccination? Have you seen that, or is there any data on that?
Right. So we do not have the data yet. Hypothetically, yes, any form of vaccination is a change in the immune profile of a person. So there is the theoretical risk, a hypothetical risk that they can develop a flare. But I think looking at what we have seen so far, in University Malaya Medical Center, we have quite a large number of patients, I think close to about 200 who have now received the vaccine. Our patients with various diseases, from rheumatoid arthritis to psoriatic arthritis to lupus to scleroderma, dermatomyositis, and so on. We've not seen a single patient getting any flare-up or worsening of the condition that requires us to change their medication, increase the steroid dose. No, we've not seen it. So I'm fairly confident. Yeah, I'm fairly confident that whatever risks there are, you know, even thrombosis, they're teaching people to look at signs, look for signs of thrombosis. It's not that different from people who have the risk when they travel 18-hour journey in a plane, or, you know, where they have a risk of developing clots. They tell you, watch for signs. So it's about being vigilant. It's about being alert. It's about being very knowledgeable and empowered as far as our personal health condition is concerned. So that's why we're telling them, don't let the worry of things such as flares frighten you. I mean, flares can happen even in the best of days, right? And what we do, we just increase the prednisolone. So we've yet to see anybody who has had to be hospitalized for lupus or rheumatoid arthritis or psoriatic arthritis getting worse. No, absolutely. We have not seen anything like that.
That's so reassuring for a lot of patients out there who may have even mild diseases but are very afraid or anxious to get the vaccine. So which brings me to my next question. I think you've sort of answered some of it earlier, but when should a patient get the vaccine? Like if they're on immunosuppressive medications, should they get it before and after? If they are in their control period, should they get it then? You know, when is the best time to get the vaccine for these kind of patients?
That's a brilliant question, and that's only a top-end specialist who will ask you questions like that, and it puts me in the spot. Yeah. So anyway, look, when the person doesn't have a disease, absolutely fine, right? They can get the vaccine. If they do have an autoimmune disorder, if the disease is mild where they don't require any treatment, that's okay. That's cool. And when the disease is quiet, when it's well controlled, is the absolute best time to get the vaccine.
Okay.
So now that brings in, but not everyone is fully controlled. There are always those lupus patients who have some proteinuria. There are some patients who have their joints disease, interstitial lung disease, and so on. So you're right. So we need to be careful about these patients if they say that, and usually, thankfully, these patients see us more frequently. And when we optimize the disease, we optimize their steroid dose, we optimize their methotrexate or mycophenolate dose, and so on, and we bring them into remission, and then yes, we would do so. So I would like to reassure everyone, say that in New Malaya Medical Center, we have close to 2,500 patients with various autoimmune disorders, and we are trying to get all of them vaccinated. And many of them who have disease activity, they present to the hospital anyway, and we control it, and within about 3 weeks, we're getting them vaccinated.
Wonderful. I think that's excellent. It's good and reassuring for, I think, your own patients also to know that they can actually come to you and just get the vaccine at your center, knowing fully well that the safety is, you know, also taken care of. That's excellent.
Yeah.
So what about patients on immunomodulating medication? So I know for people out there who are not from the medical field, there are basically various medications that autoimmune or patients with inflammatory diseases are on. Some of them suppress your immune system. Some of them, like the immune modulators, change the immune system to work in a better way. So what about the immune modulation therapy? What is the current guidelines for those on immunomodulating therapy? Prof? Sorry, Prof? Sorry, lost you for 2 seconds.
Right. Yeah. My brother tried to call me, so yeah, that's why my finger went like that. Yeah. Yeah, go ahead. So I got your question, the part about immunomodulatory. Yeah. So there again, we have certain guidelines that tell us that I told you about methotrexate, that you drop the 1 week. There is some controversy. They're telling us to actually stop mycophenolate and certain biological drugs, but I disagree because stopping those drugs actually create a risk of a flare.
Okay.
So I've overridden that. I said, no, I'm not going to stop mycophenolate for my patients. I'm going to tell them, listen, please continue, because let's say we stop the drug and they get a flare. We don't know if it's because of the vaccine or because it's one of the regular flares that they do. But if they are on mycophenolate and it's under control and they get a flare, we know that the vaccine caused the flare.
Correct. Absolutely.
So we know the causative. Yeah, so that's absolutely important for us. Yeah. So I'm going ahead with all the drugs.
Just a side note that guidelines are there to guide us. But when you have a consultant who's already managing you on a personal basis, that's where we make the decisions as a medical personnel, a medical professional. And I think that's why Prof is making these decisions for his own patients. So if you are on any specific medication, this is a disclaimer. Whatever me and Prof are discussing today is a general statement to everybody. So if you're on any particular medication, please discuss this with your personal rheumatologist or your physician, so that you don't blindly follow what is being said by random people, or you just say, oh, Prof on an interview said that I should stop my medications or I should continue my medications. No, it's a personal thing. So disclaimer, this is not personal medical advice, just to everybody out there. So Prof, would you like to have, would you maybe give us last message or tips to all your patients out there and all your followers on how to keep safe, and as a patient who's on immunosuppressives or immunomodulator, or any of the patients who have RA or SLE or lupus in any form, how do they keep safe, and what should they do to sustain during this pandemic?
Yeah, in our unit, we're working very hard to get as many of our patients vaccinated. So we have a small allocation for our patients, and we've been actually getting them, contacting them and saying, hey, listen, we've got the vaccine in. Would you like to come to our center to get vaccinated? We have a limited number, and they're released in batches, so that's why we can't get everybody in. But the good news is that the current vaccine program, as far as I know, many of my patients are getting vaccinated. So that's good. So I hope that answers the point here. Please get vaccinated as soon as possible. Second, if any of you who are following me, my Instagram channel is actually a travel blog. So yeah, and I mean, if they are following me, and if any of I think your patients are seeing that you're doing medical education and so on. I would say that congratulate yourself if you've not got COVID-19 till now. That's good. That's because to get COVID-19 is not as easy as it sounds. You have to be exposed to actually a heavy viral load. So that means if you haven't got it at all, that means you're doing all the right things. Keep doing what you're doing.
Exactly.
Physical distancing, absolutely important. I want to say 10 meters. Okay, 2 meters. You need to wear the mask. You sanitize your hands. Have that thing. And people like I suppose you're OCD as well, like me. Are you?
Yeah.
Yeah, well, I'm OCD of the first degree, and this works for me. So everyone used to laugh. Why are you washing your hands 10 times a day? Why are you washing your hands in between patients? Why do you spray everything? So I said, look, see, this is what happens. So it really works. So isolation helps right now. Yeah, at least until
Yes.
herd immunity has been achieved. I'm confident. We've got a very good immunization minister going on. I'm very confident that at least by September we would have achieved something. So hold on. I can see light at the end of the tunnel. So be brave,
Excellent.
be strong, isolate when necessary, and get vaccinated as soon as you can.
Yes. And just to end that, patients who have any form of diseases are high risk to get COVID-19. So rather than asking, should I get the vaccine? You should ask yourself, I don't want to get the infection, So I think the best way to protect yourself is to get the vaccine and, of course, maintain all the other necessary precautions that have been in place since the pandemic started in February, March last year. So thank you so much, Prof. It was wonderful seeing you again after so many years. I hope we get to see each other physically soon at some point.
Sure, that's right. Thanks for having me here. Regards to the family.
Thank you so much, and take care, stay safe, and keep washing hands.
Best advice of the week. See ya. Bye-bye.
Bye.
Take care. Bye.
Take care. Bye.